I'm Dr. Eddy Strivens, or Eddy, and I'm a specialist doctor down in Cairns, a geriatrician. So a doctor that looks after some of the diseases of getting older. And I've been asked by your doctor up in the Torres Strait to see you over the telehealth consultation to have a look at your health generally, but to concentrate on how your memory is going at the moment. So I'm going to ask you a few questions. Now, make sure you can hear me at all times. If there's anything you can't hear or understand, just give us a wave or say something to me and we can stop and go over things. And there'll be plenty of opportunity for you to ask me questions on the whole process as well. Please call me Eddy. Now, how would you like me to call you?
My name is Mary. This is my husband and this is my son and this is my family.
Okay, so Mary. So really good that you brought in your husband and son today as well. And what I'd like to do is, if it's okay with you, Mary, is if there are any questions or anything that your husband or son want to bring up as well, again, there'll be an opportunity for them to speak to me on my own, but also just at any point during the telehealth consult, they can talk to me as well.
Okay.
So what we're going to try and do is have a look at asking you some specific questions about your memory and your memory health in general. And don't worry, these are not right or wrong questions. Everyone answers them in a different way. And if there's any point you feel uncomfortable with answering any of the questions, just let me know.
Okay, Dr. Eddy.
Now, don't worry, I'll be taking some notes and writing things down as we go along as well. That's absolutely normal. Don't worry, it's not saying that there's anything wrong, but I just have to do some things to remind myself as well. So, looking at what you've told me so far, it does look like the memories are a little bit worse than we'd expect to see from your age alone. And there's a few things that's important with that. We know that memory problems can become more common as you get older. And when we're talking about dementia and some of the other causes of memory loss and other problems with thinking, these are found in a little bit more commonly in the Torres Strait and amongst Aboriginal and Torres Strait Islanders. And we see them happening at 3 to 5 times the rate as we might see on the mainland. And we see them happening at a younger age as well. And there are a few reasons for this. One of the things that's particularly important is we look at what's happening in midlife, especially with regard to your vascular health. So looking at things like managing your sugars and managing your diabetes, looking at things like reducing and treating your blood pressure and your cholesterol. And as we know, what's good for the heart is good for the brain as well. So anything we do which helps your heart will help the memory as well. And it's also important to know that when we're thinking about this, is one of the things that's always difficult with these sort of questions and answers over the video is that it seems like we're focusing in on all the things you can't do rather than really celebrating the things that you can. And we know that you're still, Mary, you're still doing lots of stuff within the community. There's lots of things you can do. You're still actively contributing, looking after the grandkids and actually still doing a lot of activities within the home and outside the home as well. And that's important because these are some of the things that keep you well as well. Even when you've got memory problems, we know that things like a traditional diet, lots of fish, we know that things like engaging in community, even things like island dancing, which if I had to design something to really be good for the heart and good for the brain is absolutely it from a physical and a cognitive health viewpoint as well. So where to from now? What I'm going to do from here is I'll prepare a report for your local doctor, and once she's got that, you might have any more questions that you'd like to ask her. And if there's any problems, please feel free to get in touch with me via your local doctor. And what I'd like to do is, if it's okay with you, Mary, is for you to ask me questions on the whole process as well.
Okay, Dr. Eddy.
Big SO to you all and see you soon. Thanks.
SO.
SO.